Sarah Jensen. I'm co-founder and co-CEO of Hue and Grace. And today we have Dr. Kathleen Valenton with us. Dr. Kathleen Valenton, I've known her for years, but she is co-founder and co-owner of Rodeo Drive Women's Health Center, one of the most sought after OBGYNs in Los Angeles. We are thrilled that you're with us today. She has a very interesting background. So she is an expert in women's health. She has 15 years experience as an OBGYN, but she also, you have extensive experience with autism. You worked with the senior therapist for children in your early part of your career, and you have an amazing background. So I'd like to welcome you. Please jump in and say if I forgot anything on your resume that I should be touching on.
Thank you, Sarah. I really appreciate that generous introduction. Yes, I do have an extensive background in women's health and also have, an interest, a personal interest in environmental factors and how it could impact health.
So today we're talking about endocrine disrupting chemicals, and I'm curious about how you first learned about EDCs and also your experience in working with them.
Yeah. So, probably the most extreme example of an EDC is diestrostilbetrol. So this is something known as DES, and it was a chemical compound that was synthesized in the 1930s and used widely because it was cheap, easy to access, and it was used widely for women who wanted to prevent miscarriage. And later on, its use was furthered in maybe treating breast cancer. So millions of women actually use this drug. So it isn't an estrogen, it's a very powerful synthetic estrogen that women were ingesting. And at the time, it seemed like it had such great qualities. Who wouldn't want to prevent miscarriage and infertility? So what they didn't know, and the scary thing is later on down the line for their children, and now we're finding, horrifically enough, their grandchildren were impacted by these exogenous or outside hormones that disrupted and were introduced and incorporated into these young fetuses, and actually having these sequelae of a higher incidence of vaginal cancer. So the type of vaginal cancer was quite aggressive. It was called, a clear cell adenocarcinoma of the vagina. And these were in puberty. In puberty, young girls were impacted by this medicine that their mothers were taking. And then another impact of this was, down the line, infertility. So, a normal uterus has the shape of a pear. In women, and I'm dealing with this now in my practice, that were exposed to DES in utero, they have a T-shaped uterus. So you can imagine that the volume of the womb just wasn't big enough. So their children would end up having problems with recurrent miscarriage and having trouble with actually keeping a baby in the womb because the cervixes were not tight enough at the very bottom due to the malformation of their uterus. So DES was pulled off the market sometime in the 1970s, but imagine the impact. 1930s to 1970s, that's millions of women affected. And now as we do these widespread studies and following, like doing these cohort studies of children born to women exposed to DES, we're finding not only in young girls, but in male fetuses, they have a higher risk of hypospadias and micropenis and some other issues with the genitals, as well as, some other esophageal atresias and malformations. Now, these are associations, but it's definitely higher in some diseases, twofold higher in women exposed to DES. So that's so scary. That's something that you think would be helping you and helping, keep a baby in, could have these long-lasting epidemiologic public health issues that people sadly have to deal with down the line. That's one example. So, some other things that are out there that we know of are pesticides. They don't only affect, sort of the breathing issues and all of the toxicity to the lungs, but they can also affect our hormones, as we know, are in delicate balance in this feedback loop. So another example of an environmental hormone disruptor that can interrupt something down the chain of normal and natural hormone production.
No, thank you for that. It's so interesting. We experienced infertility, and we were trying to research what what we were doing. We were doing everything from acupuncture and therapy and diets and everything possible, but to realize that there are things in our environment that are actually causing us this harm. And they're not just linked to infertility, but so many other diseases, cancer, as you mentioned, talk about, higher miscarriage, early menopause. There's so many correlations.
Yeah, absolutely.
Dr. Valenton, thank you so much for your time. We greatly appreciate your insight and your wisdom, and you have very valuable time, and we really appreciate you and all your work.
It's my absolute pleasure to take care of you, your family, and help the women that you want to help going forward.
You're doing it.